Hi, I'm Dr. Weichert and I'm a dermatologist at Skincare West. In this video, I'm going to add more information about Hidradenitis Suppurativa or HS. This information will focus on medical treatments for HS, and in the next video, I'll be focusing on surgical treatments. In the last video, we discussed smoking. Quitting smoking is recommended. Also, diet may contribute, and a low glycemic index or modified keto diet may help. Now I will discuss some medical treatments. The first factor to discuss is hormones, especially for women who have flares during their period. We can talk about anti-androgen or birth control pills. There's also a diuretic medicine called spironolactone for women who don't want to be on the pill. And this medicine blocks how your hormones can influence the skin at the skin level. And if your HS is mild, that can be helpful to control the hormonal aspect. Next medicine to discuss is a category called retinoids, which is a type of pill that can dry up and also open the hair follicle. This can help in some HS patients, especially those who also have more traditional acne. This treatment does not work for all HS patients. If you have a very active boil that's become problematic, we usually inject these with a steroid medicine. Our nurse can usually accommodate these urgent requests within a few days, so please contact our clinic. I mentioned that HS is an inflammatory condition, so anti-inflammatories are the centerpiece of how we treat it. We'll be talking to you about antibiotics, and we use them again not because there's an infection, but because antibiotics can act as anti-inflammatories. We treat you with 3 months of an antibiotic, and if that doesn't work well for you, you would qualify for a more potent anti-inflammatory called a biologic. Now I'm going to expand on biologic medicines. These are uniquely designed to modulate specific inflammations in the body. Adalimumab is currently the only biologic approved in Canada for HS. It goes by several other names since there are many companies who make it, but adalimumab is an immunomodulator which regulates your overly abundant immune reaction within the hair follicle. There are other biologic medicines being actively researched for HS, and we're just beginning to use these in patients who don't have an impressive response to adalimumab. I kind of make the analogy that HS is an avalanche of inflammation, and sometimes for people who have a lot of inflammation and there's a large burden of advanced HS, we need the equivalent treatment, kind of like a dump truck, and adalimumab is that dump truck. We'll talk about whether that's an appropriate treatment for your stage of HS. What are some other things you can do for HS? Laser hair removal has been effective in HS. Also, wearing light synthetic clothing which can wick away moisture from the skin can be helpful. Another tip that we've learned from our patient support groups is that Head and Shoulders shampoo as a wash to the areas where you have HS can be helpful. And some patients find that Vicks Vapor Rub can be soothing. I also like to start patients on a zinc supplement, since that's been shown to be helpful. And another thing that's helpful is resorcinol cream, which is good during a flare of HS, and this is prescribed and made up by a pharmacy. If you find the drainage to be quite odorous, there are some creams we can prescribe that would mask the smell of the drainage. I want to finish with 3 things to emphasize to all people with HS. Number 1, HS is an inflammatory condition, not an infectious condition. Number 2, it's a skin type you were born with. It's not your fault. You did not cause it. It's genetic. And number 3, there is hope and you are not alone. In the next video, I'm going to discuss surgical treatment of HS. And if you'd like to access more information developed by Canadian dermatology colleagues, go to www.hsfoundation.ca, and there you'll find a free online book on HS and much more.